Hey family and friends, this is Tanae. How y'all doing today? Guys, I'm gonna be eating some crabs and some shrimp because I'm hungry. But today we'll be talking about blood exchange. And I'm going to be telling you guys when I was pregnant, I had to get so many blood exchanges, and I'm going to tell you why I had to get blood exchanges. But I'm gonna eat a little. But I just love to eat and talk, you know what I'm saying? Make me more intimate with you guys. So, you know, that's what I'm going to do today, you guys. I'm going to eat. And then when I get through eating, because I'm hungry, I hadn't eaten anything all day because I've been so busy. And I'm going to have a surprise for you guys. You'll never expect what this surprise is, but it's going to be a surprise. But I want y'all to share my video. Tell people about Journey with Tanae going on over here. This sweet tea I have up in here. See, I got some shrimp and some blue crabs. And I'm finna tear these babies up. I like citrus stuff. Yep. I'm gonna eat a little bit, and then when I eat, I'm gonna let y'all know all about blood exchanges and why I had to get so many. But how y'all doing? How y'all been feeling? Y'all let me know down in the comments. Y'all don't mind if I eat and talk, do you? No. This is a girl crab. Wide. And a boy look like a little thin. I'm just gonna say a little thin stick. Keep it short and simple, sweet. Yeah, I love seafood. When I say I can eat some seafood, I can eat some seafood. And that's what I eat a whole lot of. Because I don't do a lot of fried food and stuff like that. I don't think I like fried is fish. Yeah. Pop it open. And these the eggs in it. Blue crab. I like that. A lot of people don't like that, but I do. Yeah, I decided to come on and do a video with you guys and let y'all know. Seems like God got me in like the slow motion state to begin to, you know, hear his voice and show me things that he needs to show me and lead me to the things that he needs to lead me to. And the people that just come into my channel, welcome. I'm a very spiritual person, and that's how I live my life. I talk about God a whole lot. You know, I'm not trying to force God on no one, but he is a big part of my life. A big part. A big part. Can't do nothing without him. Nothing. When I say nothing, nothing. Yeah. My children, they love crab. They love seafood too. If they can eat it every day, they'll eat it. And I want to thank Tam for sharing my video when I did her challenge. Thank you so much, lady. Thank you. And thank you for the people that came over from her channel to subscribe to my channel. And I really do appreciate that. about blood exchange. Cause eating crab can be a long, drawn out video. But I don't want to make that, yeah. I just had to get some food in my belly because my head is starting to hurt. But anywho. Why I had to start getting blood exchanges is I had got pregnant with my son. And when you get pregnant or anything like that, they stop all your medicine, all your medication. You cannot take any medication and stuff like that. So you're not getting the things that you need when you're pregnant, because to treat your sickle cell, or you stop your medicine. And I'm gonna read what a blood exchange is. An exchange transfusion is a medical procedure that's done by replacing your blood with blood or plasma from a donor. This is done by using a catheter to transport blood into your body. An exchange transfusion is typically used to treat life-threatening blood. Why they do that is because they taking out, they cleansing your blood, you know what I'm saying? They putting good blood in your body to help you function and help you get all your nutrients and everything that you need. So I had to have a blood exchange every month because I wasn't on my sickle cell medicine. And just because me not being on my sickle cell medicine, it can throw me into a crisis, It can cause me to have flare-ups. And, they don't want you to have flare-ups. And then they still want you to get everything you need to help you stay healthy and help the baby stay healthy. So that's why every month I had to get a blood exchange. When I say, you guys, that's something that I hated. I hated doing a blood exchange because the needle be so uncomfortable sometimes. It be so uncomfortable. And most of the time, a lot of doctors, they don't like putting it in your chem port. They'll either put it in your neck, or they'll put it like between your legs, find a vein and put it between your legs, wherever they can find a vein. Because why they don't like putting a lot of stuff in your port is because your port can get clogged up. Yeah, it can get clogged up. And then if it get clogged up, you'll have to go back into surgery. They'll have to take that port out and give you a whole new port. And you don't want to go through that. That's a long, drawn-out procedure as well, and that hurt as well. So whatever I have to do to prevent from going into the hospital or having a crisis, that's what I do. So I had a lot of complications with my son when I was pregnant. And I got preeclampsia, and that can cause you to have a stroke. That can cause you to swell up. And that can cause you to go into a crisis as well. And most of the time when you're in a crisis, you can be in a crisis for like a week, 2 weeks, for a whole month sometimes. But me, when I go into a crisis, I'll probably be in a crisis for 3 or 4 days. I'll say about 3 or 4 days. I never wanted to get blood exchanges because, I was ignorant about it, yes, because I didn't know about it. And that's why I was scared to get blood exchanges. And I was like, no. So I was happy they were taking me off all my medicine. They was like, yeah, we're taking you off all your medicine. It's because if we don't, your baby can come to this world, have a lot of issues. So, and it can cause the baby unhealthy. So what they had to do is educate me on blood exchanges. And when they educated me on blood exchanges, I prayed about it. And I was like, okay, that's good. So it's uncomfortable. It's very uncomfortable. But I did it. When I say, child, I did it. I went through it like a trooper. I was like, come on. You know how you got to get, like when you in a boxing match, you got to get ready. Got to get ready for that thing. I know it's going to be uncomfortable. I know that. The time I had a blood exchange, you guys, I said, Lord, please help me with this procedure. Because you know I hate this procedure. And all thing I had to do is get my mind right. And then as I did my blood exchanges every month, you know, my baby got healthier. I even stayed healthier. I even stayed out of the hospital. I didn't go into too many crises, but I did have a couple of crises. Yes, I did. And I did establish preeclampsia. And when I say I blew up, I was my feet was swelling up, and most of the time preeclampsia bring headaches. When I say migraine headaches, I started having migraine headaches and everything. So they had to send me in to treat my migraine headaches as well. I came out like a trooper because they told me that I wasn't supposed to have any kids at all and stuff like that. So blood exchange is a procedure that just giving you new blood, you know, it's like blood plasma, and it's coming from a donor, and it helping you to stay alive. It helping you to move to the next step. It helping you maneuver through your pregnancy. It helping you to keep your baby healthy. So whatever I had to do to not only think about myself, think about the baby in the inside of me that's growing, and you want your baby to come out healthy. You don't want your baby to come out sick, because nobody want to bring a sick child into this world. Because I always prayed, you guys, God, if I have to bring a sick child into this world, I don't want children at all. I said that. Yes, I did. I said that. I don't want children. So when I say God bless me, my son is a miracle. My daughter is a miracle. I had to have blood exchange. I didn't have to have that many with her, with my daughter Harmony, but I did have to have a lot of them. Well, let me see. Yeah, I did. Yes, I did. I had to have every month. Yeah, I had to have blood exchange every month with each child. Yes, I did. I told you guys what a blood exchange is. And when you got sickle cell, that's what you have to go through. I'm going to show you. I'm just not, not just, like I'm just telling you guys right now. But my thing, I'm going to give you keynotes, and I'm going to show you what a blood exchange.
The red blood cell exchange procedure uses a medical device called a blood cell separator. For example, the Spectra Optia apheresis system. The system uses a centrifuge that spins blood and separates it into red blood cells and other blood components. Now, let's take a look at what happens during a red blood cell exchange procedure. First, the sterile tubing set, which holds the patient's blood during the procedure, is placed on the Spectra Optia system. Next, a clinician determines how the tubing set is connected to the patient. Options include needles placed in the patient's arm or arms. Depending on the length of treatment, more permanent options may be used. Once the tubing set is connected, blood is removed from the patient and mixed with a fluid called anticoagulant, which prevents the blood from clotting. Less than a cup of blood is in the tubing set at any point during the procedure. Next, the blood is sent to the centrifuge, where the red blood cells are separated from the other blood components. The healthy donor red blood cells are returned to the patient, and when the procedure is complete, the tubing set and the red blood cells removed from the patient are thrown away. Here's what you should know about the red blood cell exchange procedure. The length of the procedure varies from patient to patient, but can often be completed in 2 hours or less. The procedure generally takes less time than a transfusion, where blood is given to the patient and not removed. During the procedure, the patient is monitored by medical staff to provide any necessary comfort measures. The recommended frequency of a red blood cell exchange procedure is determined by a doctor. While some patients may experience slight discomfort when the tubes are connected, the procedure itself is not painful. Bruising may occur depending on how the patient is connected to the system. Some patients may experience side effects. Patient anxiety may result in side effects such as headache, lightheadedness, rapid breathing, shortness of breath, chills, nausea, vomiting, and fainting. Other rare side effects may include tingling around the lips or fingers, fever, hives, itching, shock, and high or low blood pressure. Serious problems such as allergic reactions to red blood cells and infections due to viruses such as hepatitis and HIV are extremely rare. A U.S. clinical trial was conducted on the red blood cell exchange procedure with the following results. No serious adverse events were reported in 72 investigational patients tested in the clinical study. 13 of the 72 patients, or 18.1%, experienced at least one apheresis-related adverse event. Of the adverse events, mild to moderate dizziness and nausea were reported in 10 of the 13 cases. 4 patients experienced a decrease in platelet count following the red blood cell exchange procedure. However, they did not require any medical intervention. A decrease in platelet count is typical for red blood cell exchange procedure. There was no difference in the types or severity of adverse events reported for adult and pediatric participants. Talk to your doctor to learn more about the benefits and potential risks and side effects of red blood cell exchange for the transfusion management of sickle cell disease.
So, y'all, make sure you like, comment, and subscribe, and share the video. Bring them over. Yeah, bye-bye.